All right, Erica, let's go ahead and check your neck here.
Okay.
And so sometimes we like to do a seated adjustment. Sometimes for different reasons, the patient can't lay face down. So it's okay if we do it seated. There's been times where there's been dental work or some type of facial procedure, or maybe they've had a procedure on their chest. Let that rest here. Good. Awesome. That was good. All right, practice members, it's Dr. Dave Acosta. Happy Monday. We wanted to start off the video with doing an adjustment. A lot of you have requested that. But I wanted to talk today about the subluxation and what a subluxation is. So basically, whenever two of the bones are stuck together, they can put pressure on the disc and on the nerve, and that can decrease your health and your performance. So in the spine, we have 24 bones. And if we have a subluxation, let's say in the neck, where I just adjusted Erica, that can very likely cause headaches, mental fog, forgetfulness, allergies, dry eyes, pain in the neck, or shoulders, just to mention a few. If the subluxations are concentrated in the upper middle back, typically that can cause numbness or tingling or weakness into the hands, carpal tunnel. So the treatment isn't to cut the nerve, the treatment is to take the pressure off of the disc, off of the nerve there. It can also cause shortness of breath, anxiety, blood pressure issues, whether elevated or low blood pressure. So we want to take the pressure off of the nerve so that we can have that message firing correctly. If we have subluxations in the low back, that can cause low back pain, sciatica, numbness or tingling down the legs, constipation, irritable bowel. And if the subluxations are a little lower, let's say that you're seated most of the day, you're putting pressure on the low back, that can cause numbness or tingling into the legs, having to frequent urination, abnormal function in the reproductive organs. So we want to take the pressure off of the nerves there. So very important that we understand where the subluxations are. And then one last thing here is we have a classification for subluxations. Actually, two more things. We have a nice, normal, healthy bone where everything is moving properly. The disc is nice and thick. We have a subluxation where the bone is putting pressure on the disc and now we've got pressure on the nerve. If that isn't corrected, we start to get degeneration where we get arthritis in the spine. The disc dries, we've got more problems. And then if that isn't treated or corrected, we move into what's called a phase 3, where now that disc is completely dry. The bones have a lot of degeneration, a lot of arthritis, and this patient has a lot of issues with their health. So we definitely want to know where you're at. And then how do we do that? We take specific x-rays. This is an x-ray of one of our patients that we had a few months ago. This is his first x-ray. And we can see that he's got a straight neck there. I detected subluxations through my exam in the middle part of his neck. We put him under a treatment plan for 3 months. We reshot his x-ray, and this is what we have now. We have a nice curve, more space between the bones. This patient is now on wellness care. They happen to be a father of 2 young kids, a husband, and a professional. So we are influencing his health and his life for the better with chiropractic. So we want to definitely remind you of what the subluxation is, and we will be here Tuesday, Wednesday, and Thursday, sun up to sundown. So make sure and get in for your adjustment. And then if you don't know what classification you are for your spine on that degeneration model, let me know, and then I'll show you on your x-ray, or we'll take an x-ray so that we can classify that for you. In the meantime, have a healthy day, and I'll see you soon.